More and more people are developing forward head posture because we spend so much time looking forward and downward at screens. If you spend a lot of time with your head craned forward or tipped downward, the muscles that bring the head forward and down get chronically tight, and they keep your head and neck pulled forward all the time. This can lead to neck pain and cervical disc problems. I'm going to give you the two most effective exercises for releasing the tight muscles that pull the head and neck into forward head posture. Hi guys, I'm Sarah from Somatic Movement Center. I'm a clinical somatic educator and I'm the author of The Pain Relief Secret. I teach people how to relieve their chronic pain by releasing chronic muscle tension and retraining their posture and movement patterns with a movement technique called Pandiculation. Now, we used to typically see forward head posture when it occurred along with the rounding of the back, which becomes more common with increasing age. But now we're seeing more cases of forward head posture that occur without significant postural kyphosis, and it's due to use of technology, craning our head forward and tipping it downward to look at screens. And sadly, this is happening in younger people, even children. When we choose to repeat the same posture over and over, our nervous system notices. Our nervous system wants to help us be as efficient as possible, so it starts keeping us stuck in that posture all the time, even when we're not using technology. The muscles that pull our head forward gradually become tighter. These are the main drivers of the posture: the sternocleidomastoid, the anterior scalene, longus capitis, and longus coli. In response to the head and neck being pulled forward by these tight muscles, most people will tend to then contract the muscles on the back of their neck in order to tip their head up so they can keep looking forward. This causes compression of the cervical vertebrae. Our proprioception, which is our internal sense of our posture, gradually adapts to that forward head posture so that it actually feels normal and straight. This is really dangerous because forward head posture can lead to chronic pain and damage to the structure of the cervical spine. Forward head posture can cause disc degeneration in the cervical spine, nerve compression in the cervical spine, which can cause numbness and other nerve sensations down the arms and in the hands, headaches, temporomandibular joint disorders, teeth grinding, neck tension and pain, and shoulder tension and pain. If you have forward head posture, you might try to consciously stand up straight or pull your head back to correct your posture, and you probably find that it's a struggle to keep standing straight for any length of time. That's because you haven't addressed the underlying cause of the problem, which is the chronically tight muscles that are pulling your head forward. The way you can retrain your nervous system to release those tight muscles is with a movement technique called Pandiculation. Pandiculation releases chronic muscle tension by resetting the gamma loop. The gamma loop is a feedback loop in the nervous system that regulates the level of tension in our muscles. Pandiculation involves a slow, conscious concentric contraction followed by a very slow, conscious eccentric contraction. This sends accurate biofeedback to the nervous system about the level of tension in the muscles that are being pandiculated, and the result is a reduction in the resting level of tension in the muscles. If you pandiculate your muscles every day, your muscles will continue to get looser and more relaxed over time. In 2022, a study of pandiculation was published in a peer-reviewed journal for the first time. Researchers evaluated the effect of practicing pandiculation exercises in 103 patients with chronic lower back pain and/or neck pain. After completing an average of just 2.8 individual sessions, followed by practicing the exercises at home, the patient's lower back pain was reduced by 81%, and their neck pain was reduced by 80%. So now let's talk about the two exercises you can do that directly work with the tight muscles that cause forward head posture. I'm linking to a free video that teaches you the arch and curl and the head lifts. The arch and curl pandiculates the lower back, abdominals, and chest muscles, which are all involved in some way in forward head posture. The muscles in the core of your body have to work harder when any part of the spine is out of alignment, so it's really important to always work with releasing and regaining voluntary control of your core muscles. The head lifts work directly with releasing the muscles that pull the head and neck forward. You'll do this exercise with your head facing straight ahead and then turned to each side. Now, it's extremely important that you practice these movements very slowly and exactly as I instruct them, so please set aside 11 minutes to follow along with the video and do the movements correctly. Rushing through the movements will not retrain your nervous system. The nervous system has to learn new things very slowly. Another essential part of retraining any postural pattern is retraining your sense of proprioception. This is your internal sense of your posture or body position. This takes a lot of repetition over time, and it takes you focusing your conscious attention on your internal sensations. So in the video I'm linking to, I talk you through a standing awareness exercise before and after you practice the movements. The standing awareness allows you to notice how your posture and muscle tension feels before you practice the movements, and then how your posture and muscle tension has changed after you practice the movements. Taking the time to notice these changes is essential in integrating the changes into your standing posture. If you want more guidance on this process, please read this article, which I'm linking to below as well. So I hope this was helpful. If you have forward head posture, it really is worth your time to release your tight muscles and correct your posture before it gets worse and causes serious problems. And if you're already in pain, it's not too late. Releasing your tight muscles can bring your head and neck back into alignment and relieve your pain. If you want to learn more about how pandiculation and clinical somatics works, you can read my book, The Pain Relief Secret, which is available on Amazon, and you can visit my website, somaticmovementcenter.com. Thanks for watching.